good day today.
What's up?
Talk about heart disease.
We are back at it.
A picture of a spider that she asked help for, and I'm not going to help her.
You're not a fan.
I'm busy. Anyway, well, let's get to this thing, man. Heart disease. That's what we talked about last time, and we are going to continue that today with what test should you run to find out if you have heart disease? And the hint of it all was, it is not what you think. It is not your yearly blood work that you get done at your doctor for your physical each and every year that tells you that you're normal or to be on cholesterol medications, right?
Right.
So you go ahead. I'm going to see if I can share this or not here.
Yeah, so I mean, we basically have no idea when we're looking at your basic lipid panel what your risk of heart disease is. You know, when you're looking at total cholesterol, HDL, LDL, and triglycerides, you know, the most important marker on that test is actually triglycerides, believe it or not. And most people are more concerned with LDL than anything else. And so triglycerides tells us how well your body's processing sugars. So, you know, we start to see triglycerides creeping up. It can mean a lot of other stuff, you know, and that could be a discussion for a different time. But when we're looking at your overall cholesterol, total cholesterol, and then HDL, which is what they call the good cholesterol, LDL, which is what they call the bad cholesterol. In reality, again, it doesn't tell us a whole lot. It just tells us how much cholesterol is there. But let me walk you through a little bit of physiology just so you can understand how it is that we can determine whether you're plaquing or not. So when you have, your blood vessels, okay, there's 3 layers of smooth muscle. The very inside lining called the vascular epithelium. This is like a tennis net. This is the analogy I like to use. Okay, so when the LDL particles come out of the liver, they're big, fluffy particles the size of a tennis ball. Now, without the presence of inflammation and some other things, those LDL particles are able to stay big and fluffy and healthy. Now, a tennis ball can't get through that tennis net, right? So it's going to travel through your arteries, and that LDL is going to take your cholesterol where that cholesterol needs to be in order to do its job, to do one of those things that we talked about on our last live. And so the problem occurs when you have inflammation, okay? Because the inflammation will shrink those LDLs, all right? So now they become a small, dense golf ball-sized particle, and then when they enter the bloodstream, those golf balls slip right through that tennis net. And then we know it's not, you know, maybe not. No, we know that you're plaquing inside of your arteries. See, a lot of people think that cholesterol just sticks to the side of your artery and then eventually builds up. Well, the reality is it's got to slip through that first layer, and then it gets lodged between the first and second layer of the artery. That's where eventually, again, it becomes occluded, and then you have a heart attack or stroke, right? So it's not how many LDLs you have. The important thing to note is, are they big and fluffy, or are they small and dense? And this is why I tell you that the basic cholesterol testing, it just doesn't tell us a whole lot, because this is basically what they're doing. It's like if I had 2 patients in an exam room, okay? Now I got 2 scales, and there's a patient on each scale. Now, there's a curtain between us, so I can only see the number on the scale. And let's say that number says 200. But on one scale, we have a 6'2" male, and on the other scale, we've got a 4'8" female, right? So the composition of the 2 patients are dramatically different, but yet they both weigh 200 pounds. And so when you're getting your overall, your total LDL cholesterol tested, again, you're just looking at the number on the scale, so it tells us nothing about the composition of that particle. So that's what needs to be tested, guys. That's what needs to be tested. And unfortunately, your docs will never test that. And do we want to know the number one reason why? And this is kind of my opinion. Okay. But the number one reason I think that this testing is considered not medically necessary is because a statin medication, an HMG-CoA reductase inhibitor, which is what most statin medications are, has 0 effect on stopping those big fluffy particles from becoming small, dense, harmful particles. It can't stop that from happening. The only thing it does is reduce how much cholesterol you're making. But again, if you have inflammation present, right, you get the point. Even with a low overall LDL count, you can still be plaquing like crazy if there's a lot of inflammation.
Yeah. And so, I mean, again, it's like, well, what is causing your high cholesterol? Again, that's the question you should be asking your doctors, but you don't ask that question. You just say, yes, I'll take the drug. Yes, sir, daddy, sir, I'll take that drug and just do whatever you say. And then I'll take the next drug and I'll do whatever you say. Stop listening. Stop doing whatever you say. Stop just doing what they tell you to do, because it's making you sick. And the reality is, when you really look at the math, that these drugs do not help reduce the risk of heart disease. I believe there's actually a true only 1% difference between you taking a cholesterol medication and you not taking a cholesterol medication, and it reducing the risk of your heart disease. It's a 1% difference, but you got to understand all the side effects that you have where you need cholesterol to be able to produce testosterone. So men, you can't get it up anymore, and you're wondering why, and the only thing that you've changed is your cholesterol medication. Well, maybe that's a big problem. You need cholesterol for hormone production. You can't just take these side effects. I've seen people that have joint pains and things all over the place, and they have no idea what's causing it or why. And again, it's like, what's the only thing that you've changed? Well, you got on a cholesterol medication because you have a family history of heart disease, and then you didn't want to have a heart attack. So obviously you take the medication, but that is not your answer. And again, you need to look back to the days when we talked about testing. This is how to test it. Because we even talk, do you get inflammation tested? You don't test for inflammation. You don't test your CRP. You don't test your you don't test inflammatory markers. You just test HDLs and LDLs, the good cholesterols and the bad cholesterols, and that's all you look at, and that's all that's medically necessary. And the only reason they do that is because that's what they can give you a drug off of.
That's it.
You gotta follow money.
Yep. You have to test for the dense markers. You have to.
Somebody texted me the other day, said like, well, I haven't been able to get my testing done. So here's the blood work that I did not too long ago. Can you do anything off of this? So there's nothing I can do off of that. First of all, it's all normal. All of those tests are normal, and you are sick, hence why we're talking. And those medical tests cannot figure out anything until it's too late. And in one sense, thank God that you're able to find it out, but don't you want to know before it's too late? Don't you want to know when you can actually do something to take care of it? Do not wait. And so if you have blood pressure, if you have cholesterol, if you're on medications, there are things that you can and should and need to be doing right now immediately to make sure that your body is healing, but more importantly, find out what's causing it.
Yep. If
you can find out what's causing it, you can remove that and your body will restore back to normal.
Yeah, because that's the scary thing is there's so many people that are walking around with quote unquote normal testing, yep. Right? And they're ticking time bombs, and what most people base their health off of how you feel, and you feel great right before you drop dead from a heart attack. So I firmly believe this is testing that should be done on everybody, especially, especially over the age of 30, 35, 40, once you start to get, because most people, once they get to that age, they take less care of themselves. They're not exercising as much. They're eating worse. They're on the go. They're stressed out, and so age is not really a factor, but typically that's what we see. Once you start to get older, you start to get, just more sedentary and so on. So, even if you're not recommended, again, even if your overall cholesterol isn't high from the basic testing that you're having done, you still could be plaquing like crazy. And so, again, a good idea to get this done on you. If you're on cholesterol medication or on blood pressure medication, listen, high blood pressure is an indicator of vascular inflammation, which means if you've got vascular inflammation, you're going to be causing these dense particles and you're going to be plaquing. And so, listen, don't just downplay the fact that, well, my doc says I'm only on one blood pressure medication, been on it for 20 years, but it's controlling my blood pressure. Well, you still have a problem, right? Because, man, there's hundreds of thousands of people out there that are on a blood pressure medication and a cholesterol medication and it's dropping dead from a heart attack all the time, every day, right? And so, guys, we got to just look deeper in our physiology, and I understand that some of you guys don't really want to know what's lurking behind your physiology, but, that's selfish. You have people that love you, that care about you, that want you to be around. And so, some simple – and, guys, we're talking doc, what is it, like $50 or $80 for this panel? We're talking out-of-pocket expense through us, less than $100. And it's going to tell you, am I at risk of a heart attack or not? Am I at risk of dying from the number one killer or not? For $100, it's a no-brainer to me.
Yeah. And to answer Kim's question, like, how are we getting testing done? Well, we can do everything at home find out like most main triggers, but anything that is blood related, we're not able to do right at this moment. And doing the immunity test, doing this blood pressure, cholesterol type stuff, that stuff is done through blood. But now we do actually have the ability to test for some of this stuff through like a blood prick, but not specifically what you're talking about, Kim. So, you know, we have to wait for a little bit longer. And, but again, it's, you know, and Kim has been working with us for a while. So it's like, yeah, you already probably know most of your triggers and you want to just get your immune system checked. But for most other people, they haven't even had their general triggers checked for. And that's what you really need to start doing right away is get that done. You get a stool test done, get a Dutch hormone test done, get food allergy test done, get whatever it is, because you need to figure it out, you know? And but you got to do something different. And like you said, quit being selfish. I hate the statement of like, man, I don't want to find out. I don't want to know. Oh my God, that just drives me crazy. Because like, what do you mean you don't want to know? He said it, you're selfish. Why would you not want to know if something's going to kill you and you could fix it and it could extend your life and you could be there for your family longer? That makes no gosh darn sense to me, other than you're selfish and you don't care about anybody else but yourself, because you want to keep eating that crap. You want to keep drinking that crap. You don't want to change. Yep. And what we do, Doc, is we make people change, and what we do is not easy.
No, but and the cool thing is when people get results, when people start to feel better, guys, listen, I'm going to tell you, Doc's going to tell you, it's nice to feel good. I mean, it feels good to feel good. It feels good to have energy to keep up with. I got a 7 and 9 year old. He's got a 5-year-old and a new one. Like, I mean, it feels good to be able to run with them and stick with them and tire them out, right? Not like, oh my gosh, I can't keep up with my kids. Boy, you can't keep up with me, right? So but guys, we don't wait till we're sick. We would never wait until something happened. And, you know, even for all you guys that feel great and you're not on medications, guys, we can maximize your health. I mean, we can improve longevity. We can improve, you know, your performance, your mental performance, your physical performance. I mean, there's so much you can do to maximize how your body's functioning. Man, so I encourage you just to reach out to us, get some of these testing done, see what's. I was talking to a gentleman today, just a quick story, okay? He comes in for chiropractic care. Obviously, we haven't seen him in a little while because of what's going on, but he comes in and, you know, he's like, Doc, and, you know, he's always been a chiropractic patient. So shame on me for never really taking the time to educate him on everything that we do. But, you know, he said, Doc, I just got a question for you. I don't know, it's probably not related to what you can help me with, but, you know, this is what's going on. I got some pain in my stomach. I've been having these sharp pains on and off. They've done a colonoscopy. They've done an endoscopy. They put me on antibiotics and nothing's changed. Okay, let me run a stool test on you. He's like, and he kind of looks at me like, really? What do you mean? You do that? So we ended up running an expanded stool test on him. We got that back. We went over that with him this afternoon. And I mean, full-blown yeast infections, full-blown bacterial infections. His immune system markers double what they should be. His inflammatory markers way off the chart. And so, you know, he only had a little bit of pain. And I told him, and he said, well, Doc, you know, is this related to my pain? I said, you know, I can't sit here and say, yes, this is why you're having pain. But I can tell you that thank God you did have the pain. Because if you didn't have the pain and we never ran this test on you, these type of situations going on inside your gut is just flaming inflammation into you. And it's only a matter of time before it leads to another disease process, right? This guy's in a lot of pain. He gets chiropractic care for pain. Well, now he's going to be amazed on how much his pain is going to go away once we reduce inflammation in his gut, right? So just a cool story I wanted to share.
Yeah. And you know, again, I see, you know, Heather says it isn't easy to make the changes that need to be made. And you're right. It's not easy, right? But like I put up there, it's like, what would you give to feel better though? You know, if you could feel better and have that energy back and not have risk or fear of heart disease and whatnot, what is that worth to you? Because at the end of the day, you do things that you value. And if you aren't doing things to help with your health, and you don't value your health, yet you will tell me that you value your health. I guarantee that, you know, and don't tell me, show me you value your health. Show me you value yourself. Show me you value your family. Show me you value your kids. Do something about it. Take control into your own hands and do it. And yeah, Danny Nicole says, you know, well, gut health is life. And I agree, man, gut is super, super vital and super important. And that's why we do stool testing on so many different people, because like that, it's all about finding triggers. It's not about treating with supplements, and it's not about just taking a probiotic and eating a bunch of different fermented foods and veggies. It's about finding what is the cause of your inflammation, and you fix that. And that's what it's all about.
That's it.
A different approach.
Absolutely. Absolutely. To get a different result, you got to do something different.
So
very good. Very good.
So last things here is, do you guys, and I know the other day we said, if you guys want to win a food allergy test, you have to do one of a couple of things. You gotta like us, you gotta follow us, and you have to give us a review. So review us, and I'll put the link in the comments, and we're gonna be raffling off and giving away a food allergy test. It is a home finger prick. If you've done it already, you've done your food allergies, awesome. Gift it to somebody else, right? If you haven't done it, everybody needs to do it. Now,
and this test is good for everybody. I mean, symptomatic or not, on medications or not, feel great or not. This is something that, I mean, you can be allergic to broccoli, for crying out loud. You can be allergic to Brussels sprouts. These are things that knowing this information is so valuable just to maximize your results and maximize your health.
Yep. So make sure that you get on there, you give us a good 5-star review so you can get put into the drawings to win a food allergy test, and we will send that right to you. We will pay for it and take care of that for you. And that could be the missing piece of a lot of people's puzzle.
Yeah, just so you guys know, like that's over a $200 value, that test. So
yep, Dr. Miller is paying for it, so thank him.
You got it, baby.
Really popped on, dude. Julia, I actually have your bottle right here. Well, actually, this one's open. That one is your name on it. I still have it, so I haven't sent it yet. So, Tina,
I gotta win. I want to win. So that's what. Listen, you got to go 5-star review. You got to like and share our videos, and that'll qualify you.
Yep. Give us a 5. I'm writing it in the comments.
Very good. Very good. Well, listen, guys, cholesterol is such a big topic. I really hope, especially this video, as important as others. But guys, there's so many people in cholesterol. There's so much misinformation out there about cholesterol. You're being lied to. You're being lied to. You're being told it's reducing your risk of heart attack. The research is very clear. It's not. The side effects are detrimental. We're talking dementia. We're talking leg and ache pains, neuropathy, Alzheimer's. I mean, it creates so much dysfunction when you start to manipulate your cholesterol levels with the drug. So, again, if those of you that are on one, you're not willing to get off it because you know your doctor would never tell you to do anything, you need to be on CoQ10. You need to be on CoQ10 if you're not willing to get off that statin drug. All right. That's all I got. That's all I got today, Doc.
That's it. Danny, make sure you write that review so that you get in the drawing. Somebody else. Can Tina do that? Robin? Yeah, I think everybody needs an adjustment right now. Kentucky, we're the only state that chiropractors are completely shut down. So,
all right, so if I open up my garage, cash adjustments.
There you go.
Let me know who's coming.
Bashir. I think Governor Bashir is coming. Oh, goodness. But, guys, make sure you get that done. We're gonna be revealing the winner here hopefully tomorrow. There's only one review. I want it to be more than one person, and so we're not gonna do it until we get more people on there. That's the point of a drawing. So get that done, and we will get back to you with some more heart disease inflammation, and we will keep rocking it forward. Be safe, stay well in quarantine, make changes, make good decisions, and we'll see you around.